Hey everybody, and welcome to today's post. Today I want to talk about something I've talked about previously, but it was brought up in the news again this morning. Actually, I saw it on Fox News, and it was kind of interesting. The topic is the overuse of antibiotics. And I've told several of you this. You may have remembered me talking about this before, but when I was still in school, 2004, there was an ad that was run in Parenting magazine. It was a full-page ad run by the CDC, and they were encouraging parents to stop going into their pediatricians and to their doctors and demanding to have antibiotics, because most colds and viruses were actually most colds and flus were actually from viruses, and the antibiotics weren't helping. And so the CDC was trying to say basically that, you know, if you do go to the doctor and they don't make a recommendation of antibiotics, don't give them a hard time, because there is becoming an epidemic of antibiotic resistant bacteria. Now that was almost 6 years ago that article was presented, and I used to use it. I used to have copies of it in my office, and I've lost that copy. I wish I still had it. But we have, as chiropractors, have been teaching all along that it's better to allow your body to have the best chance to heal before you go into an antibiotic use situation. And then this morning on Fox News, Dr. Mark Siegel was on there, and he was talking about the overuse of antibiotics. And he was saying that there are 150 million doses of antibiotics given on an outpatient basis every year. And what's happening is last year they actually saw 140,000 cases in the emergency room of people having reactions to these antibiotics. And he also said that what's starting to happen is that, that because of the overuse of the antibiotics, and not only the good bacteria the bad bacteria being killed, but also the good bacteria being killed, our body's immune systems are not functioning properly. And on top of that, we are developing a lot of antibiotic resistant bacteria, things like MRSA and staph infection. When I first started practicing just 5 years ago, I never saw anybody with staph infection. And just in the last year, I've had 6 different people that I know, either patients or family members, that have come down with a staph infection or a MRSA infection. One was a very close relative that was actually hospitalized with it, and had the MRSA infection, and they were sequestered from everybody else in the hospital. So this is becoming really, really rampant. And one of the main points that he made on this news show today, and one that we've been making all along, is that most upper respiratory tract issues, most sinus issues, most cold issues are viruses, and antibiotics don't help with that. And he said parents and patients come in wanting something to be done, so we give them antibiotics, and usually it's more of a placebo effect, or it's just time healing the body that heals the body. It's not the antibiotic. So please really take that into consideration. Whenever you come down with a cold or a flu or even a little bit of a fever or something. And we've done multiple posts on when to use antibiotics and when not to. So get on here, type in antibiotic use, type in fever if that's what you're concerned about, type in cold, whatever it is that you're concerned about, type in that symptom and see if we've done a post on it, so that you can get the information to know if it's a good idea to use the antibiotic. Now, I am not anti-antibiotics. I am not against them. For example, Kelly, my wife, is actually on an antibiotic right now. She had the beginning of a bladder infection, which we know exactly how it started and exactly why it started. And it very, very rapidly moved from being a bladder infection into pain in her kidneys. So we knew it was moving into a kidney infection, so she got on the antibiotics immediately and got it taken care of. That's a time when they are warranted. My daughter, on the other hand, had an ingrown toenail that got horribly infected because she didn't tell us about it, and she kept wearing her shoes and kept running on it and kept kicking things, and just horribly infected. I mean, an infection I hadn't seen in a very long time, to the point that we were watching it very seriously to make sure that that we didn't have any signs of systemic infection. That's how bad it was. But we did not put her on antibiotics. An infected toe, if you watch it and treat it right, you can get it taken care of. And it did take us about 6 weeks to get it completely taken care of, but it's gone, completely handled. A toe, don't do antibiotics for it unless it's absolutely necessary. Kidney infection, yes, you got to take care of that. So there's a time and a place, and please, if you ever have any question, call me before you get on a dose of antibiotics, because it does mess up your system, and it can create a vicious cycle if you don't handle it right, and if you don't do the proper things after you're done with the treatment to get your body back to a normal balance. All right, I hope this information is helpful, and this is not what I planned on talking about today, but it was on the news this morning, so I thought it was rather interesting, and I thought I'd bring it to everybody's attention. I hope you're all having a great weekend, and I look forward to talking to you tomorrow and seeing you guys Monday evening. As always, my goal for you is to help you take control of your health before your health takes control of you, and we'll see you next time. Have a great day. Bye-bye.